And tied to that thinking or that idea of reframing, in a couple of the surveys that have the Canadian surveys, it wasn't just focused on how difficult has this been for you, what have the changes been, but there was some really helpful focus or interesting focus on, is there anything that's come out of this that you might not have expected that might actually be okay? And the COVID Survey Canada, which is actually one that is just started and is actually ongoing, this is some preliminary information from an open-ended question that asked, are there any silver linings? And so if you go through that list, you see that the connection, the sort of intentional connection with family and friends, virtually or in person if you can, is something that has happened. People are much more likely to reach out and call people they haven't chatted with for a while. The shift into virtual care, all of us who work in hospitals and health centers thought that was still years away. We've been pushing for a long time to have many more ways to be able to connect with our patients virtually, but all of a sudden that's what we're doing all day, every day. And even changes in traffic, the planes are stopped, most of the cars are stopped, many of the buses are stopped. Well, you know, during that lockdown period, that has had some positive outcomes. And if you look on the right there with the Mental Health Research Canada survey, which was done late April, there's a number of ways that activities that are maybe retro now, like reading, wow, or the pets are maybe getting a positive outcome of COVID because their people are home with them and spending more time with them. So one of the ways to think about flipping COVID has meant something scary and concerning and unknown. And so there's a colleague by the name of Russ Harris, who does some work in the US, and he has suggested that we think about COVID having a different meaning. And so here's a way to maybe, when you think of COVID, not necessarily think just about the virus and its impact, but also what else it can stand for. So COVID can mean committing to action, focusing on what you can do right now. Also that idea of opening up, recognizing that the feelings, the emotions that you're having are not unexpected, they're natural, they're normal, and letting yourself acknowledge that, and then letting yourself connect with others, maybe even to reach out and say, hey, I'm struggling a bit. The idea of you know, sometimes in a situation like this where we've had these significant changes and difficult challenges, is it really gets us focused back on what's important, what do we really value? And so looking at out of what I want to do or what I want to make a point of ensuring I'm doing, does it tie to what's important and what I value? And then the I in COVID was around identifying resources that you might need, and that could be a family friend that could maybe give you some childcare relief. It might be just a friendly face. It might be some particular mental health resources, or even knowing what the crisis resources are in case that you or a family member is really, really struggling. And the last one, oh, I went too quickly, I didn't pause. But the last one was, if I can go back, no, apparently not. The last one that was around D was just being able to develop a plan, to develop a wellness plan. I wonder, yeah, thank you. Thank you. Being able to look at particularly going forward, even as things are easing up right now, we may not be feeling the same stress or pressures, but anticipating that we're likely going to have the COVID cases increasing again, what's going to help you going forward?